teacher and I'm walking around all day. I'm up on my feet all day, and then I bend over to help kids, and it's a lot of pressure up here. So yeah, I'm just like begging for some help.
Yeah.
I know that my cervical spine, this curvature is off. It's very straight.
Yeah.
And that has been a big problem. So I would say I've been somewhat consistent with trying to get chiropractic care. My mom raised me with that, and then when I went to college, trying to find someone that worked for me was a struggle. That curvature has not changed, and I'm just ready to try to find something that works, because every day it's like I'm just constantly trying to like adjust my posture, my upper back, doing this.
Well, we'll do the best that we can to try and get you fixed up today for sure. The pain that you're having in your neck and your upper back, is it mostly just kind of like a dull, achy tightness? Is it sharp, like somebody's stabbing you? Does it burn?
I would say most of the time it's dull. It sometimes can get sharp, especially on my upper right, up here, like right in there. Sometimes I will just, because again, I've been going to chiro forever, I'll just sometimes hold and kind of bring the blood flow up there, because it can get sharp up here. But
Yeah.
that's usually when I'm just under more stress.
Yeah. Okay. How long ago was your last adjustment?
Like 2 weeks ago.
Okay. And you had said something about your mid-back from that adjustment. Was it that adjustment, or what had happened there?
Yeah, it's like the last couple of times I went, it's kind of one of those where I come in and they just go doop down my spine, and this up here always moves. It always cracks really well. But the last few times, it's like, I don't know if it was too hard or something happened, or they tweaked a nerve, but...
Let's have you sit up tall for me. You're going to bring your chin down to your chest as far as you can. Okay, and then look up to the ceiling back as far as you can. A little stiff there. Okay, and look over your right shoulder as far as you can. And then your left. Okay, not too bad. We're not turning to the left quite as well as we are to the right, although the difference is minimal. And you'll face the door, and then reach down, touch your toes as far as you can. Okay, and then come on up. You're gonna put your hands in your low back and then bend backwards as far as you can. Okay, does that make the low back pain a little bit worse?
Yeah.
Okay. Yeah, we definitely have some stuff going on with the ribs. You felt that pop already? Okay. Any pain here? Okay. A little bit tight in this right side of your hip. Nothing too crazy. Definitely tight here. Okay, so we're going to start right up here with these ribs. So my hand's going to go right here. I'm going to give your head a little turn. Keep your neck totally loose for me. I'll do all the work, okay? So we're going to go here. Good. That felt okay? All right. We're going to come in, similar deal over here. Nice and easy. Good. Okay. And high on this right side is where you're having that kind of sharpness, yeah?
It always feels tight.
Okay. Yeah. Very tight. Okay, we're going to come back to that one. Good. Okay, good release there. Doing okay? Let's see what's going on. Okay, let's try this. We're going to go here. Nice and easy, let that head fall. Good. Okay, very tough. So we're probably going to end up needing to decompress you on that side to get that to open up. But before we do that, let's finish clearing out your back. So we'll cross your arms here, and then roll you a little bit. Breathe in, out. Good. Feeling all right there? Good. Okay. Breathe in. Out. Good. Other side. Good, just like that. Breathe in. Out. Good. Okay. And let's lay you flat on your back. And lift that head up for me a little bit. Good, set it down. Now if I pull here, you okay right there, or is that give you any pain?
No, it's okay.
Okay. Trying to decompress you a little bit here. Deep breath in. Out. Good. Doing all right? Okay, let's have you go ahead and sit up and you'll face away from me. Let's take a look at this shoulder real quick. Okay, not too bad, a little bit stiff. Okay, tough. Go right here. Okay, let's try that a different way. So place your hands between your lower ribs and your waist, and then just relax your arm. Pull backwards from your elbow. Hard, hard, hard. Pull back, pull back, pull back. Okay, not quite. Let's try this one. Pull back. Harder, harder, harder. There we go. Got that one. Let's try this one more time. So pull back. Pull, 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 pull. Okay, not quite. That shoulder doesn't want to go anywhere. Okay, well, not too bad. Let's have you hop up and see how everything feels.
Feels more open right now for sure.
Yeah.
Especially my shoulders. I didn't realize how tight my shoulders felt until now.
Yeah. So we got great releases in your ribs and your upper back as well as your mid back. The neck on the left side released very well. On the right side, a little bit tight. So that's definitely something that we can kind of come back to and revisit as we keep going. Your low back moved beautifully. So not too worried about that. Yeah. Overall, your spine felt like it's pretty healthy. I don't feel anything that has me super, super concerned. Probably what I would recommend for you is something along the lines of once or twice a month. Probably twice a month for the first month or two that we work together.
Okay.
So every other week just to kind of get things more opened up. So let's have you start by sitting up tall for me. Bring your chin down to your chest as far as you can. Is that as far as you can go?
Yes.
Wow, okay. Let's have you look up to the ceiling and back as far as you can. Okay, doing fine there. Look over your right shoulder and to your left. Okay, so we're not turning to the right as well as we are to the left, and then we're really having a hard time coming down, so we want to see what that's about. And now let's have you stand up for me. You're gonna reach down, touch your toes as far as you can. Okay, very good there. And then come on up and bend backwards. Okay, so let's see what's going on. Let's have you go face down. Your face will go right here in the crack, and then you just hang your arms off the sides. Good. We'll go just like that.
Okay.
Comfortable?
Yeah.
Good. Okay. Any pain if I go here?
That's just pressure.
Okay. What about here?
Mm-mm.
Okay. Yeah, definitely tight up in these ribs. And let's have you lay on your back for me. Okay, so we'll start with your neck and then we'll kind of work our way around. For the neck, we're going to sit you up. So we'll have you sit up and face this way. And then my hand is going to go right here.
Mm-hmm.
Okay, we're going to kind of turn you and tilt you a little bit. Good. Doing okay there?
Yeah.
Good. Loose shoulder. Awesome.
Oh.
Okay.
Good.
How was that?
Good.
A little wild, huh?
Yes.
Okay.
Ooh.
You ready for the next one?
Yeah.
Okay. So, same thing. I go here, and turn you, and tilt.
Ooh.
Okay.
Wow.
How we feel?
Oh, good.
Good? Okay. So now let's have you lay face up for me. It's gonna go on your collarbone. And then this hand is gonna reach down my back like you're trying to grab the top of my pants, okay? So I'm gonna bend down, you're gonna kind of give me a little hug.
Okay.
So reach down my back, good. And then relax this whole arm. Good, okay. Deep breath in, out, loose shoulder. Good, okay. Feeling okay there?
Yeah.
So that was those ribs. Now we're gonna do that mid-back. So we're gonna go right here. Another big breath in, out, loose shoulders. Good. Okay, pretty good release there.
Yeah.
All right, so now you're gonna roll on your side and face me over here.
Okay.
Good. Okay, so your bottom leg's gonna be straight, top leg's gonna be bent. Perfect. I'm gonna pull you off this arm just a little. Good. And then we're gonna go right there. That okay?
Yeah.
All right. Deep breath in, out, loose belly. Perfect. Other side. Out. Good. Wonderful. How we feel?
Good.
Good. We'll do one more here, okay? So scoot up towards me just a little. There you go. So we're gonna see if we want to decompress you here. So lift that head up for me, and then let it down. Good. Now if I pull here, do you have any pain, or does that feel okay?
No, those are
Feels fine. Okay, so we're gonna decompress a little bit. We're not gonna get too crazy with this first one. So make sure that your teeth are touching. Good. And then breathe in through your nose, out through your nose, loose.
Ooh.
Okay. Okay, so what we'll do is we'll take a look at a few of those movements and see how everything looks compared to before. So, good. And your back bend. Better. Good. How's that feel? Good.
Much better.
Okay.
Yeah, my neck feels a lot looser.
Good. Let's have you have a seat again. And then this one was really, really tight. So let's do chin down to your chest as far as you can. Much better. I mean, that is significantly better than it was before. We'll have you look up to the ceiling and then look over your right shoulder and then your left. Okay, so we're still a little limited turning to the right. That's definitely something that we want to kind of like focus on repeatedly. Okay, so happy with your first visit?
Yeah, it's good. That was really good.
Based on what I felt, I think you're doing pretty fine. Like everything moved nice and easy for us. So your spine feels like it's relatively healthy. You definitely just had a couple areas that were quite tight that we want to kind of hone in on.
It's gonna be aggravated. Even like me just like blow drying my hair though,
Okay.
I get like if I'm using it, just gets aggravated.
And after it like flares up, is it just like super achy and
Yes.
like kind of throbbing in pain?
Yes.
Okay. And that lasts generally for a long time after your workouts, or?
Yes.
Okay. Got it. Are you a personal trainer? Is that what you do for work?
No,
Oh, okay.
no. I just got out of the military actually.
Gotcha. Okay. Well, thank you for your service. I appreciate it. Okay, so we'll take a look at your shoulder and we'll kind of take a look at the shoulder blades. Sometimes the neck can really play into
They
that.
did X-rays on it
Okay.
really recently, and they said it's normal.
Yeah, nothing came
So-
back. Yeah, and with x-rays sometimes it's like if there's nothing broken or there's nothing like very clearly that's like dislocated, sometimes it's not very good at showing pain, especially if the pain's coming from the muscles or like the joint capsule and stuff like that. So
Yeah, I was like trying. I was like, Marissa, you have arthritis. Like,
yeah.
I don't know what's wrong with you, but it's something.
Yeah, and it didn't show any like arthritic changes or anything like that on the x-ray?
No.
Okay. Yeah, it's not uncommon for patients who have like significant pain for the x-ray to come back completely normal. But what's good about that is we know that it's not broken, we know that it's not degenerated, or that there's anything, catastrophically wrong, which means that the stuff that we're going to do with you today,
It's
like
not gonna
adjusting,
Bother
it's
it.
not going to hurt anything, and then also is a good shot of making it feel better.
Yeah, hopefully.
So you've been to the chiropractor before, is that right?
Yes, but it's been like years.
Okay.
So,
Yeah.
this is not like something I do regularly.
Gotcha. Okay. So what we'll do is we'll just kind of see how well you're moving overall, and then we'll take a look at your spine, take a look at your shoulder, and just kind of go from there.
Okay,
So
you'll be able to like feel what's.
yeah, my job is basically to feel the normal motion in the joints and see if anything is stuck and not moving well, if anything's moving too much and needs to be stabilized. And based on what we feel and what we see with you, we'll be able to make a choice about what we want to do today.
Okay.
So let's have you sit up nice and tall for me to begin with. Yeah. So we're going to take the good shoulder overhead as far as you can. okay? And then bring the other shoulder overhead, okay? And then let's have you touch the thumbs above the head, okay? And then come down here, and then rotate in, okay? And rotate out, and rotate out. Okay, not too bad. So the shoulders look relatively even. I can see a little bit of like a lack of smoothness on that right side. And then let's have you bring your chin down to your chest. Okay, tightness through the back.
Yeah.
Okay, and then look up towards the ceiling, back as far as you can. Okay, come back down, look over your left shoulder, and then over your right. Okay, so you're moving pretty good in the neck there too. So let's see how everything...
I have been stretching.
Yeah.
I've been stretching a lot more, so.
Yeah, it looks like you're able to get into those movements, but it may just be that those movements are painful for you.
A little
So,
uncomfortable.
okay, so left shoulder's a good shoulder.
Mhm.
Okay. Yeah, we move pretty smooth there. Let's see what's going on here. A little bit of popping and clicking. Okay. Yeah, it feels like we're sitting a little bit forward in the joint
It
on
feels
this one.
like it needs to be like.
Yeah, come back that way.
Something like that. I don't know.
Yeah, so if you go here and put the arm in front of you, good, and then just relax everything. If I go here, is that painful?
Yes.
Okay. And then go straight out like this and hold it up. Don't let me push it down, okay? Is that painful there?
It's just a little.
A little bit. And then what if we go up like this? Is there more or less pain? Just go ahead and hold for me.
I'm sorry. It's just weak.
Yeah.
It feels weak.
Right. Hold your arms like this and don't let me push down. Okay. A little bit of like a resistance issue there. So we're going to feel the collarbone here
It like goes into the back too.
as well.
Yeah.
Okay. Okay, we're going to go here. Yeah, you got that kind of repeated popping there. Very stiff here. A little bit of tightness through the shoulder blade.
Yeah, I know once you pop that.
Okay, so let's do this. Let's have you go face down. Okay, yeah. Just got a little bit of these ribs are stuck there too.
The what?
Your ribs. So basically the rib cage has got to be moving well in order for the shoulder blade to move over the rib cage properly. If the shoulder blade can't move over the rib cage properly, then it starts to give you shoulder issues. And so
That makes sense.
this right here is just not moving very well, and I think that
Yeah.
that's probably playing into it. You also have a little bit here.
Yeah, that right one's so bad.
Let's have you lay on your back. We'll take a look at your neck here as well. You said the neck is worse on the right. Is that correct?
Yeah.
Okay. Yeah. Okay. Oh yeah, right there. Is that tender there? Okay. So we're gonna start by adjusting that, okay?
Okay.
So we'll go nice and easy. I'm gonna lift you up here. Good. Perfect. How was that? Good? Okay. Go to the other side here. Okay. Perfect. So let's get into your ribs and everything now. So scoot down just a little bit. Good. Okay.
Right there.
Yeah. So we're gonna come into this side for these ribs on the left. So this hand's gonna go here. This arm's gonna reach down my back, kind of like you're trying to grab the top of my pants, okay? So you're gonna give me like a little hug, all right?
Okay. It's sweaty.
That's okay. Sometimes people get sweaty after getting adjusted. Okay, relax the arm a little bit.
Which one?
This arm. Good. Okay. Breathe in, out, loose shoulder. Perfect. Okay. What do you think of that?
That was
A
good.
little wild, huh? Okay, so now let's do the other side. So, same type of scenario. Go ahead, reach down my back. Good. Okay. Here. Okay. And we're going to put that hand right there. Good. Breathe in. Out. Loose shoulder. Good. Perfect.
That was good.
Like that one?
Yes.
So that was great movement there through the rib. Good. Much better. Okay, here. So my hand's gonna go under your hip here, okay? And I'm gonna kind of use that like a handle, and then I'm gonna give you a little push. So everything nice and loose. Good. How'd that feel?
There still needs to be more.
Yeah. Okay, breathe in. Out. Okay. One more deep breath in. Out. Okay. All right. And then let's do this. Breathe in. Out. Good. Nice and loose. Perfect. Awesome. Okay. Great movement through there. We'll do a little bit of massage gun here to calm everything down.
How often is it good to get an adjustment done?
Just depends on what's going on with you. For you, I'd say probably something like twice a month, so every other week would be good to start with. Sometimes when people have, really serious issues going on, we need to see them either once a week or sometimes even multiple times a week. But
Yeah, I am supposed to be starting physical therapy.
okay.
September 12th. It's so tight.
Yeah. Now that we got that neck and the ribs and everything moving, this should start to calm down. Tight all through that neck too. Doing okay?
But yeah, like even when I don't work out, my trap muscles are always just so like tight.
Yeah.
So it's not like from working out, it's just
Your neck and your upper back were definitely really stuck. And so when those joints aren't moving right, the muscles begin to spasm to try and basically get them to move right or kind of reestablish proper motion. And unfortunately, if the muscles aren't able to do that, then you just have really tight spasmed muscles and the joint is still stuck. And so hopefully by getting everything moving better here, that will start to calm down the muscle spasm and reduce all this tension that you're feeling all the time. Doing okay?
yeah.
So you'll face this way.
I started to get sleepy.
Yeah. You take a nap on me? Okay, so we're gonna take a look at the shoulder here. So, come across and over. Okay, let's go here. So relax the whole arm. Good. Little bit. And then let's have you put that hand above your waist here. Yeah. Okay, relax the elbow. I'm gonna pull it towards me. And now I want you to pull back against me. So pull, pull, pull. Harder, harder, harder. There we go. Perfect. Let's see. Better. Not having as much of that popping and cracking, right?
Yeah.
Let's take a look over here. Good. And then we'll bend this elbow. There we go. Relax everything. There we go. See, that one moved pretty nice for us. Let's put that one on your waist. And then go ahead and pull back. Perfect. See how easy that one went compared to the other side? Okay, let's have you lay on your back one more time. And we're gonna do one more adjustment here just to see if your collarbone. Scoot down a little bit. Okay.
My collar.
Yeah, sometimes if your collarbone's stuck, the whole, because feel how easy this is moving back and forth. And now feel this, how stuck that feels. So we're gonna do a little adjustment for your collarbone. With this hand, you're gonna put it on the back of your neck.
This one?
Yeah, just like that. So my hand's gonna come in right here on your collarbone and your chest, okay? And then this hand's gonna be under your shoulder. Good, so we're gonna come right here. Okay. And then relax the whole arm. Perfect, okay. Deep breath in, out. Loose shoulder. Okay, little bit. Let's have you sit up and face this way again. I'll try one more here. So, my hand is gonna go right here. I'm gonna come underneath your arm. There we go. And then just relax that arm for me. Perfect. Okay. Deep breath. Exhale. Good. Loose, loose, loose. There we go. Okay. Little bit. Yeah. Still a little tough on that collarbone. But overall, things are moving much better for us. So let's do a couple of those motions again and see how everything feels. So you can have a seat right here. And kind of like we did at first. So we'll go overhead, overhead, okay, and then touch the thumbs, come down, rotate in, and out, okay. Yeah. How's that feel compared to before?
It does feel better.
Good.
I just feel like it needs more. I don't know.
Yeah, so you still have a lot of muscular tension around the shoulder, but as we continue adjusting you and as we work with you more and more, that'll start to go away. And then let's take a look at some of those neck motions. So bring your chin down to your chest as far as you can. How's that feel compared to before?
It feels good.
Less pulling. Good. And then look over your left shoulder and your right. Good.
Yeah, everything feels a little bit smoother.
Smoother, like looser, more fluid.
Yeah, it does feel like this needs to be like, I don't
A
know.
little bit? Yeah. Let's decompress you. So go ahead and lay face up on the table. So we're going to use a towel to decompress everything. So go ahead, lift that head up for me. Perfect. Okay. No pain there, right?
Mm-mm.
Okay. So we're going to give you a little pull. So let's have you take a deep breath in. Out.
Ooh. That was great.
Yeah. That's a wild one, huh?
That was crazy.
How you feel?
Gosh, that was great. That was my favorite one.
All right. So that's the big one. That kind of decompresses everything and loosens everything up. So let's try some of those motions again and see if you still feel that way.
Oh my gosh, that felt so good. Wait, which one?
Whatever you want. You can take that neck for a test drive. That feeling you were having.
Yes, that feels so much better.
Good.
I was so happy.
Good. Okay. Well, what do you think of your experience here today?
It was great.
You don't have quite the stability you want in your neck, and you probably have a little bit too much motion going on in there, which we call instability. Luckily, I don't see any degeneration. I don't see any arthritis. So basically, it looks like you're going to respond really well to treatment. What do you feel right there? Any stiffness or discomfort or anything?
Just a little bit up here.
Okay. All right. Now look back as far as you can. Good. Any issues there?
No.
Okay. Keep your shoulders still. Turn your head to the right as far as you can, looking at the camera. What do you feel there?
Just a little tightness in my neck.
It's a little bit stiff and limited. All the way to the left? Maybe a little bit less on that side. Would you agree?
Yeah.
Any stiffness,
Nope.
discomfort, limitation?
Mm-mm.
Reach from down below as high up as you can. Good. Now the other side. Okay, put your hands over your head. Watch out for this bar. And lean back as far as you can. And what do you feel right there?
Just a little tightness in my back.
Okay. Face directly away from, yeah, that way. Feet together all the way. And we're going to turn to the right as far as you can. Looking at the camera. Good. Now the other side. A lot tougher to go to the left.
It is, yeah.
And you felt discomfort?
Right here.
Okay. And up. Very good squat. How'd it feel?
Fine. That's just my knees.
You feel?
I have bad knees.
Did you feel knee pain or discomfort?
No.
Just the clicking and clacking.
Just the clicking, yeah.
All right, all right. And then deadlift. Why don't you show me? I don't have a barbell. What I have is a kettlebell.
That works.
Show me the deadlifts that you typically do that cause discomfort.
Gotcha. Basically, stiff leg deadlifts for sure hurt my back, but I feel it right here. And then if I'm going down doing a regular deadlift, let's see. I also feel it right here.
Right there. Very good. And that was your first neck adjustment.
Feels better already.
All right. A little bit lower on the other side. Very good. Okay, good. What'd you think of your first neck adjustment?
Felt great.
So now what I'm going to do is a series of muscle tests, and that's going to tell me what's working well and what's not working so well about your neck, your shoulders, all that sort of thing.
Gotcha.
Okay? Good. Thumb and pinky pulling apart. So notice we didn't get a big crack or a pop, right? Yet that clearly made a difference with your strength, right? That's what matters. The speed with which we manipulate Presses a reset or inhibits the nerve, restores the normal proper function that we're looking for your neck to have. That lower neck part where it kind of becomes the rest of your spine. Good. Very good. Pretty good flexibility in your wrist. A little bit of a segment right there. That's a little bit restricted. So I'll just do a little. And good. Relax your elbow. Perfect. Take a deep breath. Breathe on out. Very good. And I'm pulling out like that. Don't let me. Ready? Way stronger, yeah?
Yeah.
Good. All right. Now, straighten your hand, and I'm going to pull towards me. Don't let me. Again? Yeah, plenty strong.
Gotcha.
All right. All right, so I want you to put your chin to your chest. Good. And breathe out. Very good. Does that hurt?
No, it just feels a little stiff.
So look at the internal rotation difference here and there.
Yeah.
Big difference, right? All right. So I'm doing a hip manipulation here.
Okay.
So I'm going to drop it over here. And you feels like it wants to pop out, right?
Yeah.
Okay, good. No, we're doing it right. The hip flexors tested weak. The nerves that control your hip flexors exit your spine right around here. So that's what I'm going to adjust, okay?
Gotcha.
Breathe out for me. Good. Okay. And that was your first low back adjustment. Muscle test pushing down. Don't let me. Again. Lot stronger, yeah? Adjust your sacrum, which is where the nerves out of there control that motion. Take it up. There we go. So both of them went pretty easy, so they were ready to go. So raise your knee up. Hold it up right there, pushing down. A lot stronger, yes?
Yeah.
All right, good. Okay, can you actually hold on to the table so I don't slide you?
Yep.
I'm gonna yank on your arch
Gotcha.
right here, so relax it as much as possible. Does that make sense to you? That
Yeah.
If the feet aren't moving well, aren't absorbing normal shock,
Yeah.
then your hips recruit and move and activate differently.
Makes sense.
Having said that, your feet have pretty good motion, so
Okay, that's good.
fist here. What I'm going to do is push down. You just resist the way you already are and rotate your head to the left as far as you can. And back to neutral. And that was a little bit less bad, wasn't it? Let's just make sure that that's the case. Rotate your head to the left. Back to neutral and fist. Pushing down and go. Yeah, it goes further and it feels easier.
Yeah, it feels a lot easier.
All right. Basically, the message here is when we have proper stability and control of our core and our body moves way better with less distress and less discomfort.
Yeah.
What was that like for you?
It just felt a lot better when I was actually holding something and this was stabilized. It was easier to turn my neck.
Yeah.
Yeah.
Good.
Yeah.
So we do the butt touch game. That's what we call this. Purpose of this is to hinge through your hip, okay, while keeping your spine neutral. You've heard of that?
No.
Okay. So what I'm going to do is shift my butt back, tap it to the wall, and stand up straight. If I do it successfully the way I just did, then I get about a 1/4 inch off the wall, and so on and so forth.
Gotcha.
And the further we go with this, the more you're hinging through your hip, not through your spine,
Gotcha.
and you're really learning to move through your hips.
Yeah.
That was like 3.5 inches. This one's going to be really hard.
Oh, God.
I would go back a little bit.
It was like,
That's,
did I move too much? Okay.
Good. Good. Now, this time, don't touch my hands.
Don't touch your hands? Okay.
You see the difference?
Yeah.
You like to go forward with your spine versus backwards with your hips.
Gotcha.
Perfect. And stand up. I want you to stand up all the way straight and engage abs and glute kind of at the same time.
Okay.
Good. And again. Beautiful. Any irritation when you do this? Good. Super small 1/4 inch off. Good. Feel good?
Yeah.
And you're engaging here
Yeah.
at the top, at the full extension of it. All right, good. What I want you to do is start really activating your lats to create more stability in your spine during the hip hinge.
Gotcha.
So what I'm going to do that, put the bar forward a little bit. The second pair of exercises where we started with I call it the butt touch game, but the hip hinge against the wall, and then using the band, we got your lats activating. What was that like for you?
I think right off the bat, it felt a lot better when you had me doing it that way because I could actually feel everything engaged properly versus how I was doing it before. Yeah.
Good. What kind of impact do you think this will make using these couple of strategies we gave you and then the coaching cues we gave you? What difference will that make going forward with your physical health, but also with your working out, with your fitness, with all that sort of stuff?
I think it'll help specifically with my lower back pain, and it'll also help me improve strength-wise and with my form in general.
Good.
Yeah.
We learned here today was 2 things. Number 1, we got your hips moving better. Number 2, we showed you the proper mechanics of really hinging at the hip and keeping the movement and the stress out of the spine.
Yeah.
And then adding the lat engagement, which is just going to help you stay neutral during your movements. And if you do these things during the deadlift, you should feel good. And the deadlift should reinforce spinal health versus beating up on it.
Yeah.
Deadlift's a very good, healthy activity for you to be doing. But when you do it wrong, which you were a little bit, that's when it's going to beat up on you.
Gotcha.
All right?
Yeah.
Bella, how did that go for you?
Perfectly. I feel a lot better already, and I learned some interesting new things.
Good.
Yeah.
Was it scary?
No.
It wasn't scary?
No.
Good. A lot of people think it's scary.
Yeah.
Then they do it, and then it's really not all that scary. Just whatever we had in our minds kind of makes it scary sometimes. Do you think this will make a difference for you when you're at work?
Oh, yeah, definitely. Because I'm on my feet so much, so I can't, I can't have that lower back pain. So I think if I work on all of that, I'll feel a lot better at work.
Right.
Yeah.
Because you have a very active job as a bartender. You're lifting stuff. You're on your feet for long hours, and you need to really have that physical capacity, that endurance, that strength to be able to serve your customers with a smile on your face.
Yeah.
So hopefully this leads to helping with that.
Yeah.
So thank you so much for being
Thank
a great
you.
patient. You're a great sport and awesome on camera. Do you have anything else I want to say?
I don't know. Do you?
Okay.
Maybe.
Okay.
I have so much pain here.
Okay.
Here. I have difficult to take long breath.
Okay. Deep breaths.
Yeah. So I can do.
Because it
without
hurts your
problems,
back.
yeah.
Okay.
Yeah.
Sounds like a rib problems. Yeah. It doesn't come up as much.
No.
This is a lateral scapular problem. Okay. Now we're gonna fix it. Okay. Let's take a look. Right. I'd like to have you on the here. On the.
Oui.
Yes. Balances. Okay. Look straight ahead. Okay. So your head is slightly higher on the right side. So I'll put this one in this position. Okay. Same thing with your shoulders. Okay, and then we have a slight rotation of your pelvis this way, okay? But it's very subtle. Looking at your weight distribution, which is perfect.
Okay.
Exactly perfect. So this is already an indication of balance in the body, although we see a flat foot on the right and the left as well, even though the right one is more pronounced. Perfect, okay. Can you step off? And I'll have you come sitting here. All right, wonderful. Now, let me move your head a little bit. Okay, range of motion is complete. In rotation, lateral flexion, in extension. Any pain here?
No.
Okay. Let's see, shoulders, range of motion, right shoulder. Very good. Same thing here. No, fine. Now, let's look for pain points. Any tenderness here?
A little bit.
Okay. What about this side in comparison?
No.
Not so much, okay? So
Not
the
so
right
much.
side is a little more tender, yeah?
Yeah.
Should have the same finding on the first vertebra here. Should be more tender here, less so over here.
Maybe
it
equal.
Equal?
Yeah.
Okay, perfect. What about mid-neck? Should be more tender here and a little less over here?
More on
More
the
on
left
the left,
side,
yes, exactly. Now, if I go down on your pelvis, you should find a little tenderness here and less so over here.
On the right.
On the right side is
Yeah.
more tender. Perfect. Okay. Now let's take a look at shoulders. Put this hand on this shoulder like this. Now lift your elbow as much as you can. That's okay. Let's see the other one in comparison. It doesn't come up as much, eh?
No.
This is a lateral scapular problem, okay? Now we're gonna fix it. Okay. Now I will ask you to lay on your back with your face up. Very good. Let's take a look at leg length. Okay, we can already see she has a left short leg in this position, okay? Because the internal malleoli are not equal, okay? This one is a bit further up. Okay, what happens when I rotate inwards? Very good. Now, let me know which one is more painful. This one or this one?
The left.
The left one, yeah?
Yeah.
Less over here?
Yeah.
Okay,
Yeah.
good. Give me your hands up here on top. Okay, we have one phalanx of difference, okay? Start with the feet. Okay, relax. Was it painful?
No.
That's no pain here. It's release, relief.
Yeah.
Cool. Relax. Okay. Perfect. Relax. No. Your elbow works fine. Put your hand on the side of your neck. No. This is the side where you have the problem.
Yeah.
Okay. You tell me which one is more painful. 1, 2, 3.
Maybe the first one.
Here.
Yeah.
Contact it. Relax. Take a deep breath. All the way out. How was it?
Amazing.
Look. Check the elbow. No. Elbows are fine. Okay. Put this hand on the side of your neck. We'll do the same thing here.
Yeah, the first one.
Okay. Relax. Wow.
This is incredible.
It's incredible, yeah? How do you feel?
Much better.
Take a deep breath. Can you take it?
Yeah.
You don't struggle, no?
No.
Okay, good. Okay, so feel this. You move here.
Yeah.
This side, it's stiff
Yeah.
and it hurts a bit, yeah? Okay, so this is our vector, okay?
Okay.
The direction of the adjustment. Like this.
Okay.
These are the reactions I like. Now, I just did lateral flexion. Now I'm gonna do rotation.
Okay.
Here moves fine. But when I reach here, the bottom of your cervical spine, about C5, C6, yeah, this side moves. This one is stiff, it doesn't move at all, okay?
Yeah.
So I don't adjust in rotation this way, but I put the head in rotation, and then I go from posterior to anterior, okay? This is safe. Okay.
Okay. I'm still alive.
You are. No pain.
No. No.
Okay, you remember? Internally and externally, they were
Yeah.
painful. Okay. Kick up, like this. No, no, no. The thigh stays on the table. You
Okay.
just bend your knee, okay?
Okay.
Go. Okay. The other one. Push. Okay, this is fine. Now we said, what's worse, this one or this one?
The right.
Right one.
Yeah.
Okay. So I'm gonna do. Oh, you feel that?
Yeah.
It clicked as I tried to adjust it.
Yeah.
Okay. Can you shuffle down a bit towards the feet?
Yep.
Okay. Now you remember you couldn't lift the arm when he was on the shoulder. On the shoulder. Relax, relax. Fluffy, floppy. Okay. And down it goes. I want to. Down, down, down. Okay. Good or bad?
Good.
Very good.
Very good, yeah.
Relax. Ooh. Okay. The same correction on the other side. One here. Okay. Now, be on your right side. Like that. Are you ready?
Yeah.
1, 2, 3. I'm adjusting the sacrum. Relax. Ah, it doesn't want to move. Okay. Other side. You know why?
No.
Because it clicked when you were face down.
Oh,
But I still need to stimulate it the right way.
it's already done.
Yeah. Now this one's a little different. What's it like here? Pain?
Not much.
Here?
Maybe.
A little bit, okay, yeah? Relax.
Oh.
Okay, you went on preload.
Woo.
Better, yeah?
Yeah.
Sit up. Now, copy me, like this, and lift as much as you can.
Wow.
Different story, yeah?
Yeah.
Show me the other one.
My God.
Different story, yes. Okay. Stand up. Go like this. Push your elbow back against mine gradually and quick. Look at me. Like that.
Okay.
Go. Faster. No, it's okay. The other one. Slowly and okay. The right one was blocked, the left one not. Right into that spot. I'm gonna go here. I'm gonna turn you a little. Good. And then kind of lean back on my leg a little. Yeah.
Oh.
Okay.
My goodness.
How do we feel there?
That I wasn't expecting. Oh my God. Wow. Okay.
Tense one.
Wow.
This right side shouldn't feel as crazy.
Okay.
It's not quite as tight. Good.
Oh my God. I didn't even know that could happen. Oh my God.
A little
Yeah,
crazy, huh?
That felt really nice.
Good. Okay. Now let's have you go ahead and go face down. Your face will go right here where the paper is, and just drop your arms off the sides. Perfect. Just like that. A little tight in some of these spots. Any pain here?
No.
Here?
No, it just feels like tense.
Yeah, just a little tender and tight. Okay. Leave your belly as loose as you can. Give you a little twist and a little push.
Oh my God. That feels so good.
Felt good?
Oh my God. Yeah.
Good, I'm gonna lift you up.
Oh, wow.
Feel like you can breathe a little better?
I needed that.
Okay, let's have you lay on your back now. Perfect. And then scoot down just a little bit. There we go. Okay. Good. Big breath in. Out. Good. Loose shoulders.
Oh, wow.
Good. One more. Okay. I think we got most of that from face down.
Yeah.
Okay, so now let's have you lay on your side. You'll face me over here.
Like this?
Yeah. Okay, let's bring this hip forward a little bit. So scooch towards me. Yeah, perfect. Just like that. Good. So my hand's gonna go right here on this kind of butt bone there. Okay. Big breath in. Out. Good. Pretty good there? Yeah. Okay, other side. Good. This is gonna be the same kind of thing. So let's bring that hip forward a little. Good. And right there. Big breath in. Out. Good. Doing all right?
Yeah.
Okay. I'm gonna take this pillow from you, and then we're gonna do your actual hips here.
Oh.
And then one more here.
Oh. I needed that.
Kind of crazy, huh?
Oh my god, yeah.
Okay. Let's scoot you up a bit now. And then we're gonna get into your jaw.
Can you feel like this?
Yeah.
You can feel it?
Yeah, you're kicking out over on this side. So open slowly, and then close. Open, close. Yeah, we're really kicking out over here. So we need to kind of even that up a little bit and try and get that joint to calm down. So what we're gonna do is we're gonna put your head on this pillow here. I'll have you lift your head up. Perfect. Okay, so this one's gonna be a little kind of fast. But what we're gonna do is we're gonna turn your head to the side here. Good, and then you're gonna open your jaw, just like that. I wanna have you kind of relax with that. Perfect. So we're gonna go right here. Good.
Oh,
Good.
okay. That's
Doing
good.
okay?
Yeah.
All right, and then we're gonna go to this side. Good, loose. Good.
Oh my god.
Doing okay?
Mm-hmm.
Yeah. It looks a little crazier than it feels. So open, good. There it is.
Oh my god. Oh my god. Wow.
Ready for the other side?
Mm-hmm.
Okay. Good, loose. A little better. So that's one that we're going to kind of keep revisiting as we keep working with you. And then let's go ahead and decompress you, and then we'll be all set for the day. So.
I feel like I've been needing that for years.
Yeah. Okay, perfect. Right here and right here. Big breath in. Out. Loose. Good. Feel good? Okay, so we're
I
gonna.
feel like I've said that so many times.
Oh, that's okay.
Oh.
So we'll have you have a seat back over there, and let's see how everything feels now compared to before.
Yeah, it feels so good.
Yeah,
I feel like I've been needing all of that.
the jaw and everything, especially. Yeah.
Yeah. Oh yeah, the jaw. I mean, I've had it for like years now, but I just never did anything.
Yeah.
I mean, I thought I would need like surgery or something, so I just never
No.
even looked into it.
Yeah.
Yeah.
Usually we don't have to do surgery or anything like that for stuff like this. Usually it just takes a little bit to get that joint moving, and a lot of the symptoms come right down.
Yeah.
And how's that back and neck?
Oh, yeah, it feels so nice.
Good.
Oh my god, yeah.
All right.
It just feels like it was like kind of pulled apart. I
Yeah.
don't know.
Decompress, a little bit more
Decompressed,
open.
Yeah.
Cool. Well, pleasure to help you.
Thank you so much.
Are you happy with your experience here today? Good.
I've been needing that.
Good. Well, you know, everything moved pretty well. I think you're going to do really great. Probably what we would do for this is what I'd recommend is see you like once a week for 4 to 8 weeks, somewhere in that time period. And then what I try and do is I try and get my patients down to just like once a month as quickly as possible. But what I've noticed is if we start it once a month, we do this like 1 step forward, 1 step back type thing, where every time you come see me, we're right back where we started.
Yeah.
So in the beginning, if we can be a little bit more consistent, we can actually make some progress and get you out of this, and then we can taper back safely and you won't feel worse once we stop treating you.
Okay.
So roughly 4 to 8 weeks of weekly, and during that time period, you're gonna come in sometime and you're gonna be like, hey, I still feel great from last time. Cool. We'll try a 2-week follow-up. You still feel great at 2 weeks, we'll try a 3-week follow-up. You still feel great at 3 weeks, we'll try a 1 month follow-up. If you still feel great, just once a month, just to keep things moving well and keep you feeling good.
Okay, sounds good. And do you think after this, do you think the jaws, it might pop a bit more? Or
You
you
may
think...
get a little bit more popping for a
But it's
while.
normal.
Yeah, and then sometimes what happens is that just starts to go away. But what you should notice is that the popping is usually not as painful or as uncomfortable as it was before.
Yeah, because it would be uncomfortable. Like whenever I would eat, I would sometimes have to stop because it would just like hurt so much.
Yeah.
But
And sometimes what happens is patients, you have something that's popping all the time, and then all of a sudden it stops popping and it's very uncomfortable. And the reason is because it's gotten so tight that now it can't even move.
I think that's what had happened because they had like stopped popping, and I was like, is this normal or what? But I know it was off though.
Yeah. And now that we adjusted it, you saw like we opened your jaw, it popped immediately again after we opened it.
Yeah, I don't know how you just did that.
A few years ago, when I finished the army, I noticed that all this side, just I feel like it's not straight like it's supposed to.
Yeah, I feel a little out of whack.
The weapon, like,
Yeah.
like this. And
Oh, are you a veteran?
In different country.
Okay, gotcha.
Yeah, in Israel.
Gotcha.
I did the army for 2 years.
Okay.
So the weapon is sit like this, and it's like
Pulling on you.
yeah.
Okay.
And I work out almost every day, and I eat healthy, and I'm trying to be very like, but I still feel it.
Yeah. Just feel a little out of whack.
Yes, and lately it's like got worse.
Okay.
Like I literally feel like I'm not straight. Like I can go.
You feel compressed.
Yes.
Yeah. Okay. And let me have you stand up for me, and you're gonna reach down, touch your toes as far as you can. Okay. And then come on up and bend backwards as far as you can. Okay. Does that hurt?
A little bit.
A little bit. Where is it uncomfortable?
Here.
Right across there. Okay. Okay. So let's see what's going on here. What we'll do is we'll have you come on over here. You're going to go face down. Your face will go right here where the paper is. There's a little handle right there that you can grab onto. Now let me have you scoot down just a little bit. Right there. Is that comfortable for you?
Yes.
Okay. So if I press here, do you have any pain?
No.
Okay. What about here?
And it's not pain, but it's not
Just discomfort? Yeah. Okay. A little bit tight right there too. Okay. So we're going to start here with your upper back, and then we'll move our way around, okay? I'm going to give you a little push, and I'm going to turn your head to the side. So keep your neck nice and loose. Good.
Oh my gosh.
Felt good?
What? Okay.
Surprising?
Yes.
Okay. One more. We're going to go here. Good. All right, right here. My hand's going to go under your hip, and then just relax your belly. A little push. Good. Okay, same thing here. Good. Let's have you lay on your back for me now. How are we feeling?
I feel like I'm in shock.
In shock.
Wow.
Okay, scoot up towards me a little bit. Perfect. Right there. All right, nice and easy. Good. How do we feel?
Whew. It's not painful, just
Surprising.
yes.
Kind of fast. Good.
Oh my gosh.
Okay. Well, we're going to decompress you a little bit. So let's have you lift your head up for me and then set it down. Perfect. Now, if I pull here, do you have any pain, or that feels okay?
Pain.
Where do you feel the pain?
I think here,
In the
like
neck.
in here. And here.
Okay.
It's a little bit like, I don't know. For me, it's fine. I can live with it, but it's painful.
Okay.
Yeah.
I'm gonna go here. I'm gonna give you a little
Oh,
test
God.
pull and tell me if anything hurts. Okay. So, is this painful or that feels okay?
Painful a little bit
A little
here.
bit
It's like
painful.
pushing.
Does it feel like pressure?
Yes.
Okay. All right. So take a deep breath in for me. We're gonna give you a little pull. Good. There we go.
Wow.
How'd that feel?
Amazing. Wow.
Not painful, right?
No.
Like everything opened up, right?
Yes, like I felt moving.
Yeah.
Oh gosh, I love it. Okay.
Okay.
Wow.
So now let's take a look at your hips. Your
Yes.
pelvis first, and then your hips on the outside will be next, okay? Ready? So your head will go right there. Perfect. So your bottom leg is going to be straight. Top leg is going to be bent. Good. We're going to go right here and right here. Perfect. That okay for you?
Yes.
Okay. So we're going to adjust right here. Deep breath. Out.
Wow. I'm going to break something.
No, you're not going to.
Okay.
Okay, let's roll to the other side.
I don't know why I waited so many years.
Yeah.
What the heck? Okay.
You could have been feeling this good a long time ago.
Oh god.
Good. And right there. Breathe in. Good. Good.
Oh, yes.
Needed this, huh?
Definitely.
So if you lay on your back now. Second, I don't want this to grab your hair. There you go. Okay. So we're going to adjust your hip joint here. Let's see here. Yeah, okay. So let's drop this leg down. Perfect. Okay.
It's like I'm scared, but then it's fine. So
And then
I'm
it's
not
over. Yeah.
Okay. You can feel the difference, right?
Yeah, this one's tighter. It feels like. Good. Okay. So let's sit you up.
Oh my gosh. Okay.
How do we feel?
Good. I feel like this area, like, not painful, I just feel like,
Feel a little sore
yeah.
from twisting you? Yeah.
But it's fine.
Okay. Let's have you go face down. We'll do a little bit of massage gun to help that area calm down.
Okay.
This will help with that. A little bit tight. Yeah. Okay, one more thing here. Oh, you can stay right where you are. Doing okay?
Yes.
All right. Good. Okay, and that should help a little bit with the soreness, so let's have you hop up and see how that feels. Better?
Yes.
Good.
You could to see that this area it's different from here, like this more.
Yeah, a little bit
sore.
more spasmed up.
Right?
Yeah.
No, but it's better.
Good.
Definitely better.
So let's try a couple of those movements again and see how everything feels by comparison. So we'll have you stand here again and do your toe touch. Okay.
Okay.
Better?
Before it was like this, now it's like. I
Yeah, all the way
like
down.
it more.
And we'll have you bend back as far as you can. Good. That's way further than you were doing before. And then go ahead and have a seat and let's take a look at your neck. So you go chin down to your chest again. Good. Look up to the ceiling back as far as you can. And then over your right shoulder and your left. And how's that feel? I know your neck was bothering you.
Better.
Better? Yeah.
When I do like this, it's like nothing push it like
Yeah.
crazy.
You don't feel as compressed as you did before. So you're gonna reach down, touch your toes as far as you can. Okay. Not too bad there. We're a little bit flat in the low back. And then lean backwards for me as far as you can. Okay.
That's like hurts.
Where do you feel the pain?
It's all like
All through there.
That's like painful. If I ever sit in a chair and I have to like stretch my back, that's like what hurts.
Yeah. We'll do a couple of movements with your head and neck. I just want you to tell me if anything makes the pain up here or in your neck or your headache worse, okay? So I'm going to press down. Anything get worse there?
Kind of like here.
Okay. Across the crown. That make things better, worse, or no change?
Not much of a change.
Okay. If we go here, does that make things worse?
That's like through here.
Okay. Kind of a stretching, pulling. And then what about if we go here?
The same.
On this side or the other side?
Yeah, so if you're doing this, it's that
Right
side
side
and then
again.
that side the left.
Okay, so the opposite side. Okay, we're going to turn you to the left here. Fairly stiff right through there. Okay, and let's turn you to the right. Yeah. Okay. A little stiff there for sure. Okay, so let's do this. Go ahead, lay face up for me. Your head will go.
This.
Yeah.
I'm sweating.
Yeah, no problem. Kind of hot in here.
Yeah.
Sorry. And let's take a look at these hips. So we're gonna go ahead and bring this knee up. So you said they're both evenly bad, and one's not worse than the other.
Both hip flexors.
Okay. So if we go right here, any pain just coming up?
Yeah, it's like that in this area.
Okay. What about if we come across?
No.
Nothing there. If I push?
Yeah, that area.
A little bit. Okay. Any pain there?
Not too bad. It's not as tense as it is in the other
Okay.
positions.
Not too bad on your rotation. Now what about if I pull here? If I pull like this, is that relieving at all?
Yeah.
Yeah, it feels better? Okay. So if we come up this way, anything?
Yeah, it's the same.
Same. Okay, sorry.
No, it's okay.
What about here?
Not as bad.
Not as bad. Come in here.
Not as bad.
And if I push down,
Yeah,
okay.
not as bad.
Not really. Okay. You're a little bit more limited internal on this side. And then if I pull here, is this relieving in the hip?
Yeah, it feels better.
So the hips seem a little bit compressed. Let me try one more thing here. So if we lift your foot here and I'm going to strike the bottom of it, tell me if you have any pain in the hip. Nothing?
No.
Okay. We'll do that over here too. Anything? Okay. All right, so we may be a little bit just compressed into those hips. Let's check some of the muscles here. So if you hold your leg here, try and pull your knee to your chest. Okay, I'm going to resist you. Does that make the pain worse? Okay. And then push into me. Don't send me flying, but just push into me a little bit, okay? Any pain there? Okay. Pull that knee to your chest for me. Any pain? No. And then go ahead and give me a little push. Any pain? Okay. So I think you're just compressed in the hips. So we'll go ahead and adjust your hips. Okay. And then your arms will go right there. Perfect. Everything comfortable for you? Okay. So, any pain here?
In my lower back, a little
Okay.
bit where you're pushing.
What about here?
No.
Okay. And nothing there?
Yeah, where you're pushing.
Yeah. Is that sharp or dull?
It's pretty sharp.
Okay, gotcha. Yeah, okay. Your low back's very tight. Okay, and then most of your pain you're kind of feeling this area? Yeah, we're tight through there too. Okay, we're gonna start right here, okay? We're gonna do a little adjustment with your rib. My hand's gonna go under your hip, and just leave this hip nice and relaxed for me, okay? And let your belly be loose. We're gonna go here and give you a little push.
Help! Oh.
Okay.
Help.
You all right?
Oh, it hurt, yeah.
Okay. Is it still hurting or?
It's lingering, but
Okay.
no, I need it though.
Yeah, take a breath, take a couple breaths. So we got those ribs real good. That moves real well for us. It can be a little bit intense if you've never been adjusted before. A little better? Okay. Okay. Is this as sensitive as it was?
Not as bad.
Okay. All right. So we're gonna do a little bit of massage gun through here to help loosen everything up. Good. All right. We okay right there?
Yeah.
Okay. Yeah, I can feel that tension in your neck there too. So, okay, we're gonna come in right here, okay? So this is gonna be similar to the other one. We'll try and take it nice and easy on you.
You're fine.
Okay, breathe in, out, good, loose belly. Good, okay. Now, was that as bad as the other one?
No, because I knew it was coming.
Because you knew, okay, because it didn't surprise you. Good. Definitely got some stuff going on with these ribs. And right here as well. Okay. So, oops, sorry. Okay, let's have you turn your face to the left and lay your head flat. Good. I'm gonna uncover your ear there for me. There we go. Here. Okay. Let your shoulders be nice and loose, your head loose. I'm gonna give you a little push, okay? Good. Okay. Not too bad. So you go back face down again. Okay. Good. That's starting to loosen up there. So we're gonna do these ribs here. So let's have you go ahead and roll face up for me. And then let's scoot you down a little bit. Okay, a little more actually. Right there. Okay. So how this one's gonna work is we're gonna do your ribs. So this hand is gonna go on your collarbone. Okay, give me a little hug. My hand's gonna go underneath you. Okay? So, good. And then let your shoulder and arm relax. Right here. Breathe in. Out. Good. Loose shoulder. We're gonna do a similar thing on this other side. So this hand will go on your collarbone. Good. This hand will reach down my back. Good. Okay. Good. Breathe in. Out. Loose shoulder. There we go. Okay. Take a breath. So those ribs can be a little bit rough. But how are we feeling so far?
Good.
Good. So let's go ahead and adjust your low back and your hips, and then we'll come up to your neck, okay? Let's have you roll on your side. You'll face me over here. I'm gonna lift this up. This will be like a little shelf for your head. Perfect. Bottom leg straight, top leg bent. Good. I'm gonna pull you off your shoulder, and then we'll go right there. This first one's gonna be for this joint here where your tailbone and your hip come together, okay? So take a deep breath in for me, and out. Good.
Oh!
Okay.
Whoa. That was crazy.
Kind of wild, huh?
Yeah.
Felt okay?
Yeah.
Okay. So let's go over to the other side. Okay, bottom leg straight, top leg bent. Good. I'm gonna go right there and here. Okay, this side's for your low back. We're gonna go right there. Okay. Breathe in, out. Good.
No! I didn't think you could actually crack that one.
Yeah. Okay, so this leg will be straight, and then this one we're gonna give you just kind of a little pull. All right, so let's see if we wanna go more internal. Okay, so nice and easy. Good, one more, you okay? Okay, very tight on that one. So I'm gonna lift your leg up and do it a different way. So your leg's gonna kind of go on my shoulder here. Good. I'm gonna go right here. Okay. Definitely tough on that hip. Let's try the other one. So, good. This leg will go flat. Let's see if we can get better movement out of this one. Okay, nice and relaxed for me. Good. Now you felt that one move, right? So this one moved better for us. So are we still getting that pain up here? Okay. Let's come back over to this one and see what we can do. Let's scoot you back up before I pull you off the table. So, nice and relaxed for me. Yeah, tough. Okay. So that one didn't want to cooperate today. So, but we can pay that one another visit. Okay, scoot up towards me a little bit. Okay. Not too bad. So is most of your sensitivity like in there?
Yeah.
Let's see. Yeah, okay. So we're gonna adjust this area where the base of your skull connects to that first bone in your neck. So we're gonna kind of lift you up, hold you to the side, and then we're gonna push on the skull to adjust this joint here. Good. Okay.
That was a scary one. Like,
Yeah.
I was like, I don't know about this one.
Well, it's a little wild, right? How do you feel though?
It's okay.
Feels fine? Okay. So, let's see if the other side's moving better now. A little bit. Okay, we're gonna go right there. So, yeah. Okay, nice and easy. Good. Okay. That one was a little tough. You feeling okay?
It's tender.
Yeah. And try one more. Good. Okay. Yeah, tough on that one. Okay, so I think we're going to decompress you a little bit. See if we can open that up. So slide down on the table a little bit for me. Perfect. So let's have you lift your head up for me, and then we'll set this right under your neck. Good. Okay. Now if I pull here, no pain, right? Just a little stretching. So we're going to decompress you. So deep breath in. Out. Good. Loose, loose, loose. Good. Okay.
That's good.
Yeah. And I felt that all open up. So that'll help take a lot of the pressure off, especially where those nerves come out at the upper part of the neck and go to the back of the skull and can kind of trigger migraines and stuff. So let's see how all that feels now. Scoot up towards me one more time. Good. Okay. Yeah, that's starting to calm down. Are you as tender right here as you were before? Good. And then if I press right here, are you getting anything into your eye?
Not so much the eye, but right where like the back of the head is.
Okay, back here.
Yeah.
Gotcha. So this is called the sternocleidomastoid. It's a little muscle here in the front of your neck, and it can cause a lot of headaches too. So we'll give this a little bit of attention here. Doing okay? Because that headache sensation is starting to reduce. And then tell me if we get anything into the head over here.
It's like tense.
Okay, not as intense as the other side. Where in the head do you feel it? Okay, so what we'll do is we'll have you get up and we'll try a few of those motions again and see how everything feels by comparison. So I'll have you stand here and we'll do our toe touch and our back bend. Looks like we're bending a little bit more from the low back. How's that feel?
It's like a lot better.
A lot better.
Pretending to drown to working with horses and weapons.
You ride horses?
Yeah, yes.
Wow.
Yes, I do.
Well, let's get started. I'm gonna just do a quick exam on you. Your neck is a little bit compressed. And like you said, low back isn't really tight, which is surprising because you have rods down your spine. Down towards your feet, and then head up and down. Oh. Was that your shoulder? What was that? Did you feel that?
Yes.
Man, you can take pain pretty well. So this is a scar where the rods are, and what I want to do is I want to loosen up the muscles here, her erectors and also her latissimus dorsi. And I'm going to start here. The lat muscle is a huge muscle in the back, and I'm trying to just get the fascia to release. And when the fascia releases, the entire back will start to open up and be less crowded. Her erector spinae muscle right in there. Whew. You okay? Mm-hmm. Give me like 3 more. I'm going to focus a little more right in here. 3, 2, and 1. Good job. Okay, now we're gonna get into first rib. The first rib up top. Let your arms drop for me. Okay. Nice. One more time. Good. Good. Let's go on this side. Take the same thing. Deep breath in. Breathe out. Gotcha. Right there. Good. Okay. Into your hip stabilizers and your hip flexors. Just a little bit. Just loosen this part up. So let's have you kick back and forth like that. I'm gonna hold you right here. Boom. Oh, there he's popping. Pop, pop, pop. 5 more. So for this one, I'm getting into her hip flexors, but I'm also gonna start here where her ileocecal valve is. Sometimes we can hear some bubbling, gurgling sounds. That's good. That means we are actually adjusting that part of the intestine. So just go ahead and relax and breathe for me. Did you hear that? I heard it. Yeah, they're like little white sounds. Okay, good. Now, we're just going to get into your hip flexors a little more. For this, I'm going to go here, here, and here. This should be a nice stretch. So lift your arm over your head like that. Breathe in for me. Breathe out. Do you feel a stretch there?
Yes.
Yes, she does. Good. That is the adjustment there. Wow, I really hope we got that. Wow, that was cool.
That was
good job. Holy moly. Nice, good job. You're really good at breathing and relaxing. Right in here. Take a deep breath in and out. Good. Slow immobilizing. Switch sides. How'd that feel?
Good.
Scoot back towards me a little bit. Boom, bop. Kick your legs back and forth, please. Bop. Repeat. Blah. Oh, tighter on this side, eh?
Yeah.
Oh, my back cracked.
That was you.
That was me. Over your head, like so, and then I'm gonna come here into your hip flexor here. Breathe out for me. Release it, release it. There you go. Is that tender?
Yeah.
Wow. Very good. Whew, how was that?
Oh, that one's tight.
Yeah. Scoot towards me. Stop right there. Straighten the bottom leg. And breathe out for me. I gotcha. Let's be real specific for you right there. Good. You okay? There are the scalenes, the SEM, and the suboccipitals. Those are the top 3 neck muscles that I work on the most. Right here, we're in right into the suboccipitals here. Just trying to immobilize it, break up the adhesions in there. This feels really nice. It's like a deep stretch, deep in the back of the head. How does that feel?
Okay.
And then come here. Very nice. Now we're getting into scalenes. this way. So now we're going to get into her scalenes a little more. Is that tender?
Mm-hmm.
Super tender. Yeah, it's really tender on people. But she can handle it, so I'm going to keep grinding on her. She can take it. She's used to it. See, the right side's way better than the left. Do you feel a difference?
Yes.
It's probably still tender, but maybe not as much. And of course, we're going to go all the way into the attachment points here by the rib.
Keep doing it.
Yeah. I wish I could do it on myself. Very nice. Very nice. Look at that. It's already, it's already slimmed. It's crazy. Not that that's the point, but it's a nice little side thing that comes with it.
That's always the point.
Oh, okay. I didn't know that about you.
Not all of us have the genetic Korean jawline that you have, Dr. K-pop.
Now that her muscles are loosened up, we can do some adjusting. So bring your ear to your right shoulder for me. And then we got one right there. I gotcha. Slide your head to the left.
Oh. Wow. I feel like you just put my head back in the right place.
Yeah. Then we got two more up top. Let's see, one, and then this is occiput. So same thing, slide your head towards my left hand. That was deep in there.
I felt that in my right eyeball. Literally, I feel it right in here.
Wow. So we're done with the neck adjustments, but we're going to use the Y strap to traction her. No adjustment because we don't want to adjust down to her thoracic or lumbar spine, but we just want to stretch out her entire spine. Just nice, good traction. But before we do that, let's check your jaw. How's your jaw?
I don't know.
Go ahead and open your mouth for me. Okay, not bad. Open. Feel like it's a little tiny bit restricted. So let's do this. Go ahead and open for me. Close. Open.
Ow.
And then for this, you're going to check your jaw like an underbite. Yep, repeat. Really tight right here on the right side, yeah? One more time, please. Breathe in real big and relax it. Really relax these muscles. There you go. Now, I'm going to check the joint of your jaw here. Open your mouth for me and then just relax it. Yeah, it actually feels good. So we don't need to do anything. And then how about here? Open here. Same. It's moving good. So now go ahead and open your mouth. Yeah. A little more, huh? How does it feel for you?
Yeah.
Okay, good.
Actually, that's wild.
Let's do this. You're just stretching only. And I want you to do some nice deep breathing. And I'm just leaning my whole body weight back and just allowing her body to stretch at her own pace. And if you look, her neck is slowly starting to elongate. Slowly starting to get longer. How about maybe 3 more, just like that, Michelle? How was that?
Good. I could feel it like in my upper back, which was nice.
I'm gonna do your extremities. I don't think we've done this before.
No, we haven't.
Okay. Any tightness through here?
Definitely in the chest because I have scar tissue right there, right now.
Okay. Let's get in there. Yeah.
Oh.
Good. Relax, relax. Sorry.
Oh.
Woo! Good job. Why do you just take it? Why don't you tell me that it hurts?
Because I like it when it hurts.
My type of patient. Oh, something already popped. Right there.
Ooh.
It's a little baby one.
Yeah.
If I had done it, I think it would have been louder, but I was kind of seeing how you would react.
you crack your knuckles?
Mm-hmm.
Pre-game? Yeah, you did. Nice. Love it.
That hand one felt so good.
The wrist?
Yeah.
Yeah. Let's do the shoulder on this side. Yep, kind of leave it like that and come right there. And I have to distract you out.
Oh. Oh.
Did you feel that?
Yeah. Oh, that felt so good.
Yeah.
Yeah.
Gives you a little space.
Yeah.
Did you feel it in your clavicle or?
Behind.
Behind. Okay. Great. Let's do your hips. I don't think we've ever done the hips either.
No.
Like this. First. And squeeze your knees together really hard.
It's like immediate. Wow.
We're popping in places that we haven't done. Okay.
Obviously they needed it.
That was great. Let's do the hip pull. I think you're gonna like this one too.
Mm-hmm.
So relax, relax, relax. Give it to me, I gotcha. Good. Sorry I didn't warn you. Yeah, I'm basically yanking your hip. Did you feel that? What'd you feel?
Everything.
Got the 8-away scraper, and I'm gonna put a little bit of CBD, and we're gonna scrape.
Like a fascia scraper?
Yeah, and then we're gonna kind of, it's heated too. We're gonna scrape through here. Okay, so I'm gonna apply a little bit of lotion. And put this guy on. So how does that feel? I'm gonna go gradually. I'm gonna go gradually deeper, but how does that feel right now? Ooh, you're feeling that, huh?
Yeah. That's nice.
Let's go here. How does that feel?
Good.
Do you feel it?
Mm-hmm.
Do you feel the heat?
Mm-hmm.
Okay, how was that?
Which is nice.
Yeah, your neck definitely looks longer.
My neck feels way better.
Yeah.
Like whatever was compressed feels like open now.
Let me just check what I'm feeling here. Okay.
Okay.
Wow. Okay. There's a lot.
What are these noises?
I'm excited. There's a lot of information today.
Okay.
Okay. I'm just gonna start because it's all over the place.
A lot of tension.
Yes, but let me tell you what it's from.
Okay.
There's 4 things. First thing I feel has to do with your father.
Oh.
Second thing I feel has to do with your partner or a future partner. And the third thing I feel has to do with work, finance. And the fourth thing I feel is I just get this feeling that when you were younger, someone was very hurtful in the things they said to you, or you were very sensitive to perhaps criticism or something along those lines that kind of got lodged in your neck. Does any of that resonate?
All of that resonates. I wasn't ready for that.
I wasn't either.
No, but that's good. This
Crazy.
is great.
Okay. The reason why things like this come up is because we carry all of this in our bodies, as you can imagine.
Yeah.
And when I work, I like to address those things so that we can release on a physical, but also on an emotional, energetic level as well. And then go slowly back, all the way back. Good. Let's go look straight forward. And then I want you to rotate your head to the left. Okay, rotate to the right. Your range is pretty good so far, range of motion. A little restricted there on the right.
How do you feel that?
Look straight, and then this time let's go ear to your shoulder. And then how about the other way? Slightly restricted. Okay, so what I'm gonna do is we're gonna release the traps here, work on muscles here.
Okay.
So let's start by going side to side. Okay, and then repeat. Okay, go ahead. Oh, the other thing that I didn't tell you was that I can tell that you're extremely intuitive. You're very connected to...
I'm kind of like an empath. I definitely feel everything around me. I'm affected by that for sure.
Took the words out of my mouth. You're a musician?
I am.
Is that your creative outlet to channel all that?
I'm not very good with speaking about my feelings, so I kind of just write about them.
Sort of that we mentioned, are they related to each other?
Yeah, I would say so.
Okay, what's going on?
Honestly,
obviously, you're carrying a lot of tension about
yeah, work is definitely a big one of those.
Okay, what's going on?
So although I am a musician,
I work in commercial advertising.
Oh, okay.
It's very demanding. And just trying to climb that ladder and work for somebody else when you're kind of an entrepreneur.
Sure.
It's tough.
Yeah.
It's definitely tough.
Give me 2 more.
Okay.
Ooh, right here. Super tight.
That's so funny how it's like harder for me to even move.
Kind of the situation you're in. You have, like a corporate job, but in the meantime, you have another way of, you're an entrepreneur, a musician, and you're trying to do something else. It's almost like we kind of have to live double lives while we're doing that, right?
Completely.
Especially
that's literally it.
Trying to survive in this modern age of crazy inflation, no more middle class. Let's go here. Switch. And one aspect is very left brain, and the other aspect is very right brain, which could work if you just, find a good balance, right?
Yeah.
How are you doing so far? Good.
Good. It feels really good.
Yep. So now, relax your arms, bring your head all the way down towards your feet, head up, repeat. Yeah. Good job.
Felt that. So good.
Do you get massages?
I do. I love massages.
Okay. What do they say? You're super tight every time?
Always. They're always like, relax.
Yeah. And remind me, have you been to a chiropractor before?
I have not.
First time.
First
timer. Oh boy.
I've been dying to come to a chiropractor though, so very glad to be here.
Oh, I'm honored to hopefully offer a good experience for your first time. Adjustments, okay?
Sounds good.
Now for the neck.
Feels great.
Okay, I'm gonna start off with this mid-back release. I'm gonna raise you up and we're gonna kind of do a little traction here.
Okay.
So you're going to interlock your hands behind your neck. Was that your shoulder?
Yeah.
Perfect. Okay, elbows in and then fall back. Yep, but bring your elbows in more. Yep, and then try to relax if that makes sense. And then like you're laying on a bed.
Okay. Oh, there it goes. Yes.
Oh my God, how's that?
Nice, yes.
Yeah, let's do this side first. This side's a little tight. Come this way. I'm going to. I know this is really weird, but this is actually
Do your thing.
It's actually kind of. It should be comfortable for you because I'm sort of bracing you like that.
Oh, okay. Yes.
Is that okay?
Absolutely.
Good.
Yeah, it's great. I definitely needed this.
Okay, let's have you go face down.
Please.
Give me like 5 more.
Okay.
And then for this, I want you to go towards the floor like that. Bam.
Okay.
Bam. Repeat. Oh.
Yes.
Did something crack?
Yeah.
You gotta say those. Like 5 more. 5, 4, 3. Oh! Everything is cracking. Just no. Not good. Have you ever had someone pull your skin?
No.
Try it on you?
Sure.
Does that sound weird?
That sounds a little weird, but I'm down. You're the doctor.
It actually kind of feels nice. It feels like human skin bubble wrap.
Oh, okay. Sounds interesting. What does this do exactly?
Hold on.
Oh.
Does that hurt?
No, not at all.
Is it kind of weird?
It's definitely a little weird actually, but.
There it is. So I want to release it. Take a deep breath in. Breathe out. Good, I got you. I'm going to just turn my head a little like this. Good.
Oh.
You okay?
Yes.
It's really, really stiff. I'm trying to get you on this side. Take a deep breath in. Turn your head a little. Breathe out. Right there. Good.
kick your leg back and forth like that. Okay, I'm gonna get right here. Ready? Go. Up. Yep. Now this one is your hip flexor, but we also sometimes get right here where you have your ileocecal valve right here, which is where your large intestine is, and sometimes we get an adjustment there. Okay, so relax here. I want you to just breathe. Oh, did you hear that?
Yeah.
I already went. Breathe. Good. I want you to breathe a little more. Good. Okay. So for this, I'm going to let it hang. I'm going to stretch it out. We're going to get deep into the hip flexor now.
Okay.
I need you to breathe in real big. Breathe out. You'll like this stretch. You feel that?
Absolutely.
Yeah. Do you do like box jumps and stuff?
I haven't in a while, but I used to. I had a trainer.
I can tell. Body never lies. Breathe out. I gotcha. You're not gonna fall.
Oh, wow. Wasn't ready for that, but I felt really good.
That was like clunky. It was like.
I really needed this.
Yeah.
Like, I really did.
Holy. Holy. Let's go that way. Do you cross your right leg over your left?
Yeah, I do.
That tends to be the side you favor.
And you know what? Actually, this hip,
Yeah.
like, it gets stuck sometimes. It gets weird. Like, if I, like,
Oh.
do hip openers,
Yeah.
like, my hip will, like, click.
Okay. Relax. Breathe in for me. Breathe out. Oh, excellent. Come back up. Let's do this side. Hey, so that was your second adjustment, the lower back. Straighten your bottom leg. Right? So this will be your third. This will be number 3. Take a deep breath in. Breathe out. I got you. You won't fall. Yeah, there it is.
Oh. That was a lot.
How was that? That was your third adjustment ever in your life.
That was really good.
Yeah.
Like, I really felt that, like, up my spine.
Yeah.
Every time it cracks, I'm just like, yes.
Up your scalene muscles here. Let me know if it's too much. Let me know if it hurts too much. It shouldn't hurt so good.
Yeah, it's a good hurt so far.
Okay. So curious, going back to what we talked about earlier, first thing that came up was your dad. Are you worried about him? Is there anything going on with him?
Not particularly at the moment, but
Okay.
we've kind of always had a rough relationship.
Got it. And then how about your partner? You have a partner right now?
No partner right now.
Okay.
But it's definitely an area.
That you want to manifest?
Yes.
Interesting.
Oh yeah, I imagine they definitely all affect each other. This feels so good.
Yeah.
What was that?
That's your scaling muscle.
Oh wow.
This is really tight.
Yeah. Wow. I like felt that in my shoulder.
Good. Now here, this is your suboccipital muscle here.
Okay.
When it's tight, it can cause headaches, dizziness, and migraines.
Interesting.
You have any of that?
I've been having a lot of dizziness lately.
Oh wow. Okay. So it's coming from here.
Oh.
Is it tolerable?
Yeah.
Barely?
No, it feels good.
Okay. Let me know if it's too much.
Okay.
Let's check your jaw. Let's see if you... not bad.
As long as I can remember.
Okay, go ahead and open your mouth. Close it. Again. How does that feel?
It feels fine. There's just like a small click.
Click. Okay, is it okay if we work on this a little?
Sure.
Go ahead and open your mouth. Close and repeat. Okay, now I'm gonna get here. Go ahead. Give me like 5 more. I don't know if you can tell, but your jaw tends to deviate that way when you open.
Go ahead and open your mouth. So what I'm trying to do is get it to
Go back.
yeah. So now from here, you're gonna jut your jaw like an underbite. Close it. Repeat it. Maybe like 5 more. Is that tender? Very much so. Okay, now 5 more here. 4, 3. Good. Last but not least, I'm going to check to see how your joint is moving. So open your mouth here. I'm just going to press here, okay? Stuck. Not as bad on the left side. Your right side is stuck. Yep, just relax it. So open it, but relax it. Yep. So you're gonna feel a little pop here. Right there. Yep, good.
Oh, wow. I can definitely feel the click. It's definitely more subtle, for sure.
Yeah.
How that even happens.
You probably clench your teeth, clench your jaw. You probably clench, you probably grind. You hold your tension. You might chew more on the right side, but yeah, we can do more next time. Whew, good job. That was cool. Okay, now let's get to your neck. We remember this side would not, it was this side, the first side, didn't adjust very well.
Okay.
So we just got a few more. How you doing, Mother? You all right?
Yeah, I'm doing great. This is fantastic.
So I got one right here, and I want you to bring your ear towards your right shoulder.
I love
So neck adjustments, they sound loud because they're right by the ear, but they should feel like a good relief, good release.
it. Absolutely.
So let me just check. We already got this side up top, so this side is all good, but I feel some tightness here on the left. So you're gonna slide your head towards your left shoulder. Give it to me a little more. Oh.
That's the good stuff.
I need a moment.
What is
process?
Yeah, this is interesting. Like, because you seem like very in tune with energy as well. Like, as soon as I came in, you've kind of read me off very on point. So how does it affect you, giving people adjustments and releasing their energy?
Good question. I have to make sure that I'm grounded. I have to make sure that I clear and cleanse as well. And I have to have a very specific type of lifestyle so that I'm not taking that home with me all the time, or that I'm not muddled and not being able to hear and be clear. So yeah, it affects me, but not like in a harmful way or anything, as long as I'm doing my part.
Right.
Yeah.
Okay. It's interesting.
Yeah, thanks for asking. You want to try the white strap?
What is it?
You want to try the white strap where we make you taller?
Okay.
And you trying to get to 5'9"?
Yeah.
Why?
Just always wanted to be a little taller.
Everyone always says that. And actually, I wouldn't mind either.
Right?
Okay, so for this, I want you to take a nice deep inhale and really let your joints relax. You feel a little bit of attraction starting now. And I want you to breathe in real big and out. Good. Exactly, just like that. Okay, keep up that type of breathing. And I want you big and out. Good. Exactly, just like that. Okay, keep up that type of breathing. And I want you to relax your chest. See if you can let that chest sort of drop down, and you'll feel a little pop.
Yeah. Yep.
I did a really, really, really light adjustment on you. Really, really subtle.
It did not feel light.
Where did you feel it?
I can feel it like in my upper back.
Did it go down?
Yeah.
Yeah.
It did not feel light at all.
I gotcha. No? Okay.
I'm afraid to crack my nipples.
Why?
I don't know.
You don't like the sound of it?
It just, I don't know, it scares me.
I know people like that. Okay, check the other side. Sorry.
Yes, thank you. Nipples have not been cracked in
Okay, you said your right hip was tight, yeah?
Yeah.
This one's gonna kind of open you up a little. I think you'll like this one. You just relax. I gotcha. Relax. Let it.
I have a hard time relaxing.
Yeah, I can tell. I heard that.
Yeah,
Did you feel it?
Yeah, definitely did something.
Okay, same thing here. Just let it fall. Good. Okay. Oh, yes. Okay.
Thank you.
You survived?
Yes.
How do you feel?
I feel really.
Here?
No, just uncomfortableness.
What about there?
No.
Okay. Here?
No.
Okay. Yeah, okay. Tender there.
Mm-hmm.
Yeah, it doesn't feel the most comfortable. So I'm going to turn you a little bit here, and then just let me have all the way to that head. So you're going to feel some pressure, and then right where you feel that pressure, I'm just going to give you kind of a quick push, okay?
Okay.
So loose as you can.
Pretty good thing.
There's a Kleenex for you.
Thank
Yeah.
A good feeling, of course.
Yeah. Yeah, sometimes you don't realize how much you're holding on to.
Oh, yeah.
Good. Okay. Let that head just fall. Good.
Oh, yeah. No words can explain. Just a feeling emotionally.
Yeah. Kind of comes out of nowhere too. It's like just all of a sudden you're like, whoa, why am I crying?
Yeah. I guess months, or you just hold it off and you push it off like, I'm gonna go later.
Mm-hmm.
Just go. Should have done this a long time ago.
Okay. Big breath in. You're gonna blow it all the way out. Let your shoulders fall. Yeah. And out. Good.
Ooh, the spots that I've been needing. Wow. Okay.
Okay. So now we'll have you lay on your side. You'll face me over here. And then we're going to see exactly what we need to do here in your low back. Okay. So I'm going to give you a bit of a roll, and then I'm going to fall on you.
Okay.
Good.
Oh.
Good. Doing okay?
Yes.
And now let's have you lay on the other side. Good. Right here. Okay. Okay, I'm going to go right here. Big breath. Good.
Yes. Mm,
That was a good one.
that was a great one.
So now let's have you lay on your back again for me. And then scoot down here a little bit till your ankles hang off. Good.
Ooh. That felt like it went up to, I was feeling that popping.
Yeah, it can decompress the low back too.
That was great. I had a breeze for a second.
Yeah. Now we're gonna do the knee. This one's just gonna be a quick little pull. Good. And then we're gonna bend this knee a bit. Good. There it is. Okay, we'll have you scoot up just a little bit before I pull you off the table. So now we're gonna do this hip.
Ooh.
We're gonna bend it a little bit. Good, perfect. Okay, now this ankle likes to go into inversion, does not like to go into eversion, so we're gonna try to roll you back this way a bit and improve this motion. Doing okay there?
Yes.
Good.
I feel
But that's one we're definitely gonna have to come back to.
Okay.
For sure.
No problem.
Okay, and then let's scoot you all the way up to the top again. And let's take a look at this elbow. Doing okay there?
Yes, that's like the exact feeling I've been trying to get.
Because I think in your paperwork you said it felt like it needed to pop.
Yes, because when I would go to the gym and I want to work out like this specific muscle and I would use the machine to press down, it wants to pop.
Good.
Okay.
Doing okay?
Yes.
Good. Okay. And then we'll do the other side, that way you're feel even. Loose for me. Good. Again, teeth slightly apart. Yeah, this right side.
Mm-hmm.
Okay, so I'm going to position your head, turn to the side here. Okay. So you're going to have your teeth just slightly apart. Good. And my hand's going to come in like right here, okay?
Okay.
And the big one with this one is just kind of fast.
Okay.
There we go.
Oh. No worries. I guess it's been, what, a year?
Yeah.
Wow, okay.
Loose. And just kind of slightly relaxed here. Yeah. Yeah, that right side is still hanging on for dear life. Okay. So we're going to try the left side, and we may come back and try that right side one more time. Let's just see how the left side goes. So, make it a little sticky square so I don't slip. Good. Right here. Loose as you can. There we go. Okay.
Mm-hmm.
Doing all right.
I felt it on this side too.
Yeah.
Right
You
here
feel a
on the
little
right
bit of that.
side.
And then let's have you lay on your left shoulder. Good. Okay. I'm going to push it down a little. Yep.
Mm-hmm.
Good. Okay. That's an awful lot. Let's have you lay on your back for me. Okay. Open, close, open, close, and then loose. Yeah, better. Quick pull. You just want to stay as loose as you can.
Great. I felt that.
Yeah, that one will go all the way down.
Ooh. Yes. Especially played soccer for so long and then just injury after injury, and then just small mistakes can cause this.
Yeah.
Okay.
And it builds up over time, you know.
Oh yes.
You don't realize, you know, how rough it is until we start slamming on you and you feel how it feels in your body. So
I feel it.
Yeah.
Amazing.
Doing okay.
Yes.
So what do you think about your first chiropractic visit?
Well over the above, worth it.
Okay.
Definitely worth it. You're very detailed. You tell me what you're gonna do. You assist me positioning correctly. And there's no words to describe by the words, and instead of, it's better just to be on the table.
Yeah.
No words. There's no words to describe. Everybody's different. Every patient's different.
Mm-hmm.
You just You have to treat yourself. You only have one body of a temple. You need to take care of it.
Yeah.
And that's how I see it. And I'm glad and grateful that I came. Thank you.
I'm happy to help. I'm happy to help 100%.